because there is this guy that I've never heard of before named Demetre Daskalakis, and I love that name. Like, I just love to say it. Daskalakis, right? Like, is that
That
not a great
anything with
name?
lots of K's in it, you're like, "Ah, ah, ah, ah," that sound, you love that sound.
I do. And
You
that
do.
I listen,
Mhm.
that's a good name. Now the
Yeah.
guy himself is a complete lunatic, and
No.
he is a CDC, he's some bigwig at the CDC, or at least he was until yesterday
Mhm.
when he decided to resign for all kinds of like dramatic reasons, cuz basically he hates RFK.
Oh, okay.
And so I was like, "What? Why is this guy being so public and weird about his resignation?" And so the whole letter that he wrote to the CDC about resigning is so just self-indulgent and over the top. We're not including the whole thing, but if you could just read these
Oh,
sections that
God.
we have.
Okay. My resignation letter from CDC. Dear Dr. Howery, is that his name?
Yeah, I don't know.
I am writing to formally resign from my position as director of the National Center of Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, CDC, effective August 28th, 2025, close of business. I am happy to stay on for 2 weeks to provide transition if requested. Well, that's nice that he's doing that. This decision has not come easily as I deeply value the work that the CDC does in safeguarding public health and am proud of my contributions to that critical mission. However, after much contemplation and reflection on recent developments and perspectives brought to light by Secretary Robert F. Kennedy Jr., I find that the views he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people. Enough is enough.
So here's a little more.
I am unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than improve the public's health. The recent change in the adult and children's immunization schedule threaten the lives of the youngest Americans and pregnant people.
That's when I was like, okay, nothing else you say matters because you refer to women as
Pregnant
pregnant
people.
people. And
Mhm.
that is not acceptable.
Yeah,
So here's a
but then he's
little,
talking about scientific reality, and he
right,
says pregnant
exactly.
people. Okay.
Exactly. So here's a
Uh-huh.
tiny bit more.
For decades, I have been a trusted voice in the LGBTQ community when it comes to critical health topics. I must also cite the recklessness of the administration and their efforts to erase transgender populations, cease critical domestic and international HIV programming, and terminate key research to support equity as part of my decision.
And here's how he signed off.
Sincerely, Dimitri C. Daskalakis, MD, MPH, he,
He,
his,
his,
him.
him. I mean, I can't.
Bye.
So
Bye. We won't need you for 2 weeks. Bye.
I was just
Bye.
like, you listen, I might have been interested to hear
Right.
what you had to
The
say
first
about why you're
the
leaving
first
CDC, and then
paragraph
you
was
ruined it.
a nice first paragraph, and then it was like,
Right.
yeah.
So then, as this started to travel through the
Uh-huh.
social
Right.
sphere, then it was revealed that this is him.
Oh,
So,
okay.
so
All
Rob
right.
Smith posted the fewer public health professionals that we have serving in government who think it's a great idea to pose in a pentagram harness for a magazine cover, the better.
Yes.
Bye.
Yeah.
This is
I mean,
who we've had serving in the CDC.
bye. Seriously. It's like, what on what planet is that a good idea as a
Just,
professional
I
in
mean,
any profession to wear a pentagram harness for a photo shoot in any profession?
yeah. Well,
Bye.
and apparently this, I mean, he has made waves in right-wing circles before because of his penchant for wearing pentagram harnesses. And
Jeez.
so people accused him of being satanic, which he roundly rejects. He says that is absolutely not true. I am
Oh,
not a Satanist. I just wear really high-end harnesses. That's his excuse,
okay.
you
It's just
guys.
provocative. It gets the people going.
I
Okay.
can't. I cannot
High-end heart.
with
Okay.
these people. I cannot. What this guy and what so many other people need is medication, which by the way, they do actually have medication for depression included at all family pharmacy.
They do. They have a lot of stuff there. They have ivermectin starting at just $2 per capsule. Um, most ivermectin, and mebendazole is now up to 25% off. They have that. They have hydroxychloroquine. They have antibiotics. They have NAD, which is the cutting edge anti-aging injectable that is taking the country by storm. They have methylene blue, which is what RFK Jr. talks about a lot. They have a lot of the prescriptions that you're probably already taking. You can bundle stuff. You can have it shipped right to your door, hassle-free, transparent pricing. There are no surprise bills. All Family Pharmacy is awesome, you guys. It's trusted by thousands of Americans who are already taking the middleman out of the equation, and then they want to take control of their own health, which is what conservatives do, right? This is what we do. You can order online in minutes. A licensed doctor reviews and approves your prescription. Just get free, like put your medical freedom back in your hands. Go to allfamilypharmacy.com/chicks. See what's out there. Use code CHICKS10. Order some today. It's your health, your choice. No more waiting. No more sitting at a doc in the box. That's allfamilypharmacy.com/chicks, code CHICKS